more than a dozen studies, including a combined analysis of 1.2 million vaccinated children, failed to find a link between vaccines and autism. A 1998 Lancet article by Andrew Wakefield, who was a doctor, first reported a link between the MMR vaccine and autism. It was only based on 12 cases, and it was retracted in 2012 due to it having incorrect data, and he was then disciplined for fraud and lost his medical license. Some background information on immunizations and vaccines are: immunizations is defined as the action of making a person or animal immune to infection, typically by inclination. A vaccine is something that stimulates the body's immune system to indicate a response to protect the person against subsequent infection or disease. This is done by needle, can be taken by mouth, or by aerosol. Children vaccinated for the following diseases from birth up to 12 years old: tetanus, polio, hepatitis A and B, measles, mumps, rubella, and rotavirus. Some history behind vaccinations are: Edward Jenner from the 16th century was an English physician, and he was the contributor of the smallpox vaccine. He observed that milkmaids who got cowpox were immune to smallpox. And in the 17th century, a French chemist and microbiologist named Louis Pasteur developed antidotes and cures to many dangerous illnesses such as anthrax and rabies. He isolated the anthrax bacteria, heated it up, and injected it in 25 cows. Then he injected it into 25 more cows a little while later, and he found that the 25 vaccinated cows were the only ones that lived. Some common knowledge on immunizations include: diseases such as smallpox and polio have been eradicated from the U.S., meaning they are no longer an issue. Children attending public schools or visiting public places are less likely to catch or spread these diseases if they are vaccinated. Some think that vaccines cause the disease that they're trying to prevent. An example would be the polio and smallpox vaccine that are made from the inactive virus, but the virus is actually killed using heat or chemicals. According to the American Academy of Pediatrics, childhood vaccinations are 90 to 99% effective in preventing diseases. Some think that side effects from vaccines are autism. Could be autism, but that is not true. Like previously mentioned, that was proven to be false. Andrew Wakefield, again, the doctor who made that article, that was not true. What if you can't afford immunizations? According to the Center of Disease Control and Prevention, every $1 spent on vaccination saves the person and the public $6.30 in medical costs. Also, there are many local resources to utilize that administer low-cost or free vaccinations. The VFC, which stands for Vaccines for Children, is a program federally funded that provides vaccines at no cost to children who may not have the ability to pay for them. The act was passed by Congress in 1993 to develop the VFC. Over 40,000 physicians are enrolled in this program. Some state and local requirements regarding vaccinations are: school entry are important tools for maintaining high vaccinations, covering rates, and in turn, lower rates of vaccine preventable diseases, which is called VPDs. School children and also private school children or daycare also need to be vaccinated, and it is a requirement. All states provide medical exemptions, and some states offer religious exemptions. Some religions that don't vaccinate anyone are the Muslim religions. Authorities declare that vaccines are unacceptable since they contain pork-derived products, and consuming pork in any way is forbidden. In 2017, Islamic leaders signed the Dakar Declaration which is a vaccination document, it states that it's necessary for vaccinations to protect them from diseases and it also informs them of the religious jurisprudence regarding the use of vaccinations. Discusses the needs and the history and the respect on parents to do the right thing for their children. Religions that has clear support of vaccinations are the Catholic Church, because the risks the risks do not outweigh the religious warnings of not using them. The process of which a vaccine goes through is that many tests are given before the public. There are many tests that the vaccination goes through before given to the public, and officials never allow providers to give it out if it wasn't safe. According to the Center of Disease Control and Prevention, the new vaccinations go through a multiple-step process before it's even administered. This involves careful testing and monitoring before, during, and after the vaccination is approved. Clinical trials, thousands of human subjects, and deciding if it works and it's safe. There's a reporting system that tracks reported side effects around the country once publicly available. Vaccinations save millions of lives per year. According to the World Health Organization measures, vaccines alone saved more than 17 million lives between the year 2000 and 2015. The World Health Organization also said that the measles vaccine saved that many people as well. Vaccines and immunizations save billions of dollars in healthcare due to the short term. People think that the short term effect of vaccinations, it's too expensive, but the long term is that it would save money if you got the disease. Meaning, if you think it's too expensive to get a vaccine right now, then when you do get that disease, because you didn't get the vaccine, it's going to cost you more money in the long term. And the medical costs of someone you gave the disease to, and the money it took to contain the disease once it is spread. Vaccinations and immunizations are also important against antibiotic resistance. They help fight against antibiotics. According to the World Health Organization, the overuse and misuse of antibiotics has become a major public health concern. Vaccines reduce the risk of illness, which causes the use of antibiotics. Vaccines could be needleless. Wouldn't that be nice? Vaccines are currently done by injection, but animal studies show that they could have an oral vaccine that could become an alternative. Using needles is always a risk in a healthcare facility anyways. Before you're born, you can also be immunized. Mothers can protect their children in the womb. The Mayo Clinic states that a mother should get the flu and the Tdap shot to protect babies until they are born and can get their own vaccines. In conclusion, based on all of my research I've done, here are 5 more reasons that vaccines should be given to everyone and everyone. They save your life and your child's life. They are safe and they are effective. They protect others that you care about as well. You can save money and time in the long run by getting these vaccines, and they protect future generations. Imagine if there was never a vaccine for polio and smallpox. Thank you.